MD Internal Medicine from Osmania Medical College in Hyderabad, and then went on to do his DM in Endocrinology from the Postgraduate Institute of Medical Education Research, Chandigarh, and where he was trained in the use of radioisotopes in medicine, and also he received training in RIA technique from Finland also. He came back to work in Hyderabad and worked in the departments of endocrinology of Osmania and Gandhi Medical College. He went on to become the professor and head of department of endocrinology at Gandhi Medical College, and has more than 30 years of experience in the field of endocrinology. He has been the past president of the Research Society for Study of Diabetes in India in 2006. He's currently the president of the Hyderabad Society of Endocrinology. He's also been the president of the All India Association of Advancing Research in Obesity, and the former president of the Association of Physicians of India of the Hyderabad chapter. And he was, in fact, the first to introduce the DEXA scan in this part of the country, and he is now actually for a period of time he's gone into active politics. He's still involved in active politics, and he's been a legislature has been part of the legislative assembly in the last previous term. And so I think I have great pleasure in inviting Professor Sudhakar Rao to come onto the dais. And Dr. G. Chandrasekhar Reddy has been the professor and head of Department of Endocrinology at Osmania Medical College. He did his MBBS from Kurnool Medical College in 1971, went on to do his MD in medicine again from the Kurnool Medical College before he went for DM in training in endocrinology from the Banaras Hindu University in 1987. He has been working in the Department of Endocrinology at Osmania Medical College, from where he retired in 1995, and 2005. He was awarded the fellowship of the American College of Endocrinology in April 2006 at Chicago. He worked as professor of endocrinology for 15 years at Osmania Medical College and Osmania General Hospital. He is currently Professor Emeritus in Endocrinology from the NTR University of Medical Sciences, and he has received several awards to his credit, of which the important ones being the Best Doctor Award, the Rashtriya Ratan Award in 2003, Eminent Citizen of India Award of 2004, Vaidya Shiromani Award in the year 2004, and Man of the Year for 2005 by the American Biographical Institute. And he is also currently, he has been in the governing council of the NTR University of Health Sciences for a long period of time. He served in that capacity in the NTR University of Health Sciences. I have great pleasure in inviting Professor G.C. Reddy to the dais and requesting Professor Andrew Bolton to do the honors. So, well, it's again my privilege to introduce Dr. P.V. Rao, who has been well known to all of you here, and he has been very actively involved with our Research Society for Study of Diabetes in India. He did his MBBS from the Andhra University in 1977 and went on to do MD in medicine from the Madras University. He did a diploma in diabetology from the University of Zagreb in 1988, and also did some a course in food and nutrition in 1989, and went on to do his PhD in endocrinology from the All India Institute of Medical Sciences. He worked for a long period of time in the Nizam's Institute of Medical Sciences, where he retired very recently in 2015. He worked as professor of endocrinology at the Nizam's Institute of Medical Sciences, and he has numerous publications in national and international peer-reviewed journals. He has full-time research projects for 7 years after post-graduation medicine, and received research grants from diabetes research for diabetes research from ICMR, CSIR, NHS, and NIH and WHO. He was secretary of the, as I was mentioning, he was the secretary of the Research Society for Study of Diabetes in India between 1993 and 2007, and played a very important role in increasing the membership of this society and making it a very vibrant society as it stands today. He was the first to publish global gene expression in Asian Indians with diabetes and protein biomarkers of diabetes in human urine and saliva. He is invited post. He conducted several invited CME programs in diabetology and accredited programs and web CMEs in diabetology. He is currently, as I just mentioned, he's just very recently retired from the Nizam's Institute of Medical Sciences, and is currently the interim CEO of diabetomics, and also the research director of research at the Ramdev Hospital at Kukatpalli in Hyderabad. So I have great pleasure in inviting him to come on to the dais and and requesting Professor Andrew Bolton to do the honors. So I think it was indeed a proud moment for us to felicitate our senior colleagues in endocrinology and diabetes, and I thank you all for the patient attendance. I mean, for coming here and being part of this felicitation. Thank you.
Thank you all for your patience. We will now move on to the symposium. I would like to. The first talk would be modern management of diabetes, and to chair this session, I would like to invite Professor Vijay Shekhar Reddy, Professor Jayanti Ramesh, Head of Department Endocrinology, Osmania Medical College and Hospital, and Dr. Neelaveni, Additional Professor Endocrinology, Osmania Medical College and Hospital.
Hello. A very good evening, respected teachers, my senior colleagues, my friends and distinguished guests. Once again, I welcome you all for this evening International Symposium on Diabetes being conducted by Idea Centers. And it really gives me an immense pleasure, and I feel honored and delighted session chair the oration in memory of Dr. Shyam Sundar P, who is my teacher and mentor, by a renowned diabetologist, by Dr. Andrew Bolton. Before we introduce and invite him to the dais, I like to have few words. I want to talk to you about Shyam Sundar, sir. A few words, because I was his student. The contribution to the field of endocrinology, at least in this part of the country, by him is unmeasurable and unforgettable. He is a very distinguished academician, a great orator, a good clinician, and an inspiring teacher. Personally to me, he is a teacher who has made absolute difference for me pursuing the career in endocrinology, because I was doing my thesis. He is a very distinguished academician, a great orator, a good clinician, and an inspiring teacher. Personally to me, he is a teacher who has made absolute difference for me pursuing the career in endocrinology, because I was doing my thesis under him, and later on we published that my subject as a post at ADA. And he was always very inspiring teacher. He was accommodative. He is approachable, and he was encouraging teacher. On very few occasions, I had an opportunity to, even after my completion of my DM, I had an opportunity to ask him some doubts, just because his house is just opposite. And he used to tell me, Vijay, I believe in you. You believe in yourself. And you do what you believe firmly. And with that encouraging, words he has infused in me, I never looked back again. And one day again, he has called me to his house somewhere in the month of August of 2004. And I was surprised. It was very shocking to me. Vijay, I am dying in another 1.5 months. I believe you. You please take all these books to the Department of Endocrinology at Gandhi Medical College, and he has given all his books. And for his memory, he has given his subject of interest, that was this gynecology. He has got gold medal in gynecology, obstetric and gynecology during his undergraduation days. So he has given me a gynec endocrinology book written by Speroffs, and that is there still with me now. And with these words, I'd like to hand over the mic to Ramesh.
Thank you, Vijay. The fond memories of Professor Shamsundar. We'll now enter to the action. This is the modern management of diabetes. Diabetes is a progressive disease, and the treatment or the management is a continuum. So evolution is always happening. And many things have happened in insulin. The practical management of diabetes, which is actually the modern management of diabetes. We have here a globally renowned speaker, Professor Andrew Bolton. He is one of the pioneer members in the research on diabetes foot. He is currently the president of European Association of Study of Diabetes. He is working as a professor of medicine and diabetes at the University of Manchester. Published over 300 peer-reviewed journals, peer-reviewed papers, and has received many awards, including the International Award to Diabetic Foot Research in 1995, Edward Elmos Award for Advocacy in Prevention of Amputation in Diabetes. He also received awards from the American Diabetes Association and the EASD in recognition of his work. Professor Bolton, formerly the editor of Diabetic Medicine, and is currently an associate editor of the Journal of Diabetes Care. He is also an advisor to the National Institute of Health for the EDIC and DCCT studies. I welcome Professor Bolton onto the stage for his lecture on modern management of diabetes, the role of insulin analogs.
Thank you very much for your kind words of introduction. It's always a pleasure to be in India. My first visit here to your country was to what was then Madras 30 years ago. And people asked me, what can we learn? What can they learn from us in England? I said, you should ask what we have learnt from you, because we learnt from India how to look after diabetic foot problems, which I'll return to later. And it's also a pleasure to felicitate so many senior individuals here in Hyderabad. It used to be Andhra Pradesh. I can't pronounce the new state, but it begins with T. And it's wonderful to see such academic learning going on and research here in your state, or your two states now. So I will start here, and this was our senior medical officer, Sir Liam Donaldson, who some years ago wrote these words: if you always do what you always did, you will always get what you always got. So in other words, we need to move forward and look at new ways of researching diabetes. Now, there is a global burden of diabetes, as you all know, which we're facing at the present time. And for the first time in our history, non-communicable diseases have become the leading cause of global mortality. And that includes here in India and other parts of Asia. And diabetes has overtaken all the infectious diseases put together. We have an epidemic, and necessarily